Minimally invasive surgery should be everyone's first choice at surgery if possible. We know that there is less risk, less complications, less bleeding, less infection. We know the patient has the opportunity to heal faster, get back, in the case of a woman, get back to the workplace, get back to the care of her family. So again, if possible, MIGS is the way to go. In laparoscopic surgery, we make small incisions, oftentimes an incision at the belly button and then two lateral, perhaps one below. In particularly large masses, or when deemed necessary, we may even place incisions above the belly button. But at the end of the day, we're generally placing about 3, maybe 4 different incisions on the abdominal cavity. These incisions are anywhere from 5 millimeters, 1/5 of an inch, to as big as perhaps 12 millimeters. In order to place our instruments through those little bitty incisions, we have to place ports. Those are basically tubes which allows us to place our instruments through those small incisions, and so that we can do our procedures. So when we talk about port sites, they're basically our incisions that we utilize to place our instruments to perform our minimally invasive surgery. Over the years, there have been different techniques to close these port sites, because at the end of the day, yes, they are small incisions, but even though very small, during the course of our manipulating the tissue through the operation, sometimes they can enlarge. So that 5 millimeter little incision may no longer be 5 millimeters. The trouble with that kind of closure is number one, if you're not that competent laparoscopically, it's sometimes very difficult to grab that suture. The second concern about that type of closure is that oftentimes it can strangulate tissue. Strangulation of tissue can ultimately lead to poor closure, to pain, and even the potential of nerve entrapment. So it was, although it became the standard, it was really less than ideal. We've already talked about the problem with the current methods of performing port site closure. But what happens if you don't close the port site? Or what happens if you close the port site improperly? At that point, you can put your patient at risk of having herniation. Herniation occurs when there is not proper closure and different organs inside the abdominal cavity are able to come up through that incision. So port site herniation certainly is a concern to the minimally invasive gynecologic surgeon. So it certainly is a big deal that needs to be addressed. I believe that the risk of port site herniation is really understated. It's a risk that must be addressed because of the potential complication. And it is something that we can take care of at the time of our procedure. We can make this complication go away. neoClose offers a very innovative way of closing the port site, closing that incision. When you deal with a standard closure, you make a loop going from one side of the tissue, dropping off the suture, going to the other side of the tissue, grasping that suture and coming out. It adds to the concern about strangulation of tissue, the potential risk of nerve entrapment. The advantage of neoClose and its anchoring system is that you do not have this strangulation of tissue. So you're able to gain the closure without the strangulation, without the potential risk. Furthermore, it's a technique that really is to the advantage of the physician because it's so easy to master. I've had a good deal of experience with neoClose. Not only have I used it to close the port sites, not only have my partners used it to close the port sites, but even my fellow in minimally invasive surgery, under my tutelage, has become an expert in closure of these port sites in no time. Again, because it is so easy to use and so quickly learned. When you approximate tissue, you are going to get your very best closure. We know that. That's what we do as surgeons. We are taught from day one of our residencies is to never strangulate tissue. Strangulated tissue necroses. It breaks down. It does not heal well. When you go ahead and you're able to approximate that tissue, you don't have that concern. That's the difference between neoClose and all the other closure systems on the market. You're not going to have the strangulation of tissue that is seen in everyday use with the other systems that involve loop closure. I am sure through use of neoClose, we are going to see a marked reduction in port herniation. Not only will we see that, but I think we'll also reduce the incidence of pain at port site. Why? Because we will not see this strangulation of tissue. We will not see the nerve entrapment. We will not see the breakdown of tissue and the scar tissue as a result. So I do believe that the innovative process of using this anchoring system that is neoClose will prove to be the most practical, the most effective way of closing the port site, and will soon become the standard of care. I believe it's important for the patient to have a discussion with her physician when she is going to undergo laparoscopic surgery in regards to port sites. Not only from a standpoint of how many port sites are going to be placed, but also the size of those port sites. I also think it is important to understand how that physician is going to close those port sites. Why do you want to know about the number? Obviously, from a standpoint of the potential risk. More incisions, more risk of herniation. Number two, why do you want to know about the size? Because again, when you have larger port sites, there is a larger risk of port site herniation. But it is also imperative for that patient to be able to understand how those ports are going to be closed. If the patient is having her incisions closed in the traditional loop manner, that patient's closure is at greater risk of breaking down. She is at greater risk of having pain and nerve entrapment. Use of the neoClose will change the dynamics, will change the paradigm. Less risk of subsequent herniation, less risk of tissue breakdown, less risk of nerve entrapment, less risk of tissue strangulation. Win, 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 win. And that's why I've chosen to close with neoClose.